Zepbound will return as a preferred option on Caremark's drug lists starting October 1st, 2026. Coverage is not automatic. Your employer or health plan must use those lists and include obesity medicines. Wegovy will remain preferred while Zepbound returns beside it. Employers can exclude obesity medicines or require plan approval. Being preferred adds an option, but your plan still decides whether it will pay. Caremark manages prescription drug benefits for employers and health plans. It negotiates prices and builds standard formularies, which are lists of medicines a plan may cover. The employer or health plan chooses which formulary and benefits its members receive. The retail pharmacy and Caremark perform different jobs. The pharmacy fills prescriptions. Caremark manages insurance benefits. A pharmacy can have Zepbound in stock and fill the prescription, while your health plan still refuses to pay for it. This return reverses a restriction that began July 1st, 2025. Caremark removed Zepbound from commercial formularies and kept Wegovy preferred. Some affected patients switched medicines, requested an exception, or paid full price when coverage stopped. Caremark announced the reversal on May 28, 2026, with the change taking effect October 1st. A denial before October can still reflect the existing formulary because plans do not have to implement the new placement early. The announcement applies to commercial formularies. It does not automatically set coverage for Medicare, Medicaid, federal employee programs, union plans, or customized health plans. Those programs can use different drug lists and different approval rules. Think of insurance access as 3 gates. First, your benefits must include obesity medicines. A plan that excludes the entire category can still deny Zepbound even when the drug appears as preferred on a standard Caremark formulary. Second, the formulary must actually apply to you. Caremark offers standard options, but employers can customize benefits. 2 people can use Caremark and still receive different Zepbound decisions because their employers chose different coverage. Third comes the insurance approval process. Your clinician may need to send medical records before the plan agrees to pay. Being preferred can make access easier, but paperwork, limits on each fill, and reviews for continued coverage can still apply. Preferred status also does not equal a low price. It describes where a medicine sits on the drug list. Your plan's payment rules and pharmacy network determine what you pay. Insurance approval and pharmacy inventory are separate. Your plan can approve Zepbound while a pharmacy has none in stock. The opposite also happens. A pharmacy may have the drug, while your plan rejects payment because that location is outside its network. Your clinician can explain why you need Zepbound, but cannot create coverage your employer excluded. When plan approval is required, the plan compares the medical records with its written approval rules. That makes the exact reason for a denial important. A public Caremark document shows how detailed its approval rules can be. For weight management, it requires 6 months in a structured program using diet, exercise, and behavior changes before medication begins. That document uses body mass index measured before treatment. One pathway requires at least 30, another allows at least 27 with a weight-related condition, such as high blood pressure, type 2 diabetes, or abnormal cholesterol. That measurement comes from before weight loss medication started, not today's number. This matters for people who already lost weight on Zepbound, Wegovy, or another medicine. Their current body mass index may be below the initial approval threshold because treatment worked. Older records can therefore become crucial. The prescriber may need the original weight, earlier body mass index, and health conditions that supported approval. Without those records, a reviewer may see improved current measurements without seeing the evidence that supported treatment at the beginning. Renewal adds another checkpoint. The published rules require at least 3 months on a stable long-term dose. They also require losing at least 5% from starting weight, or staying at least 5% below that starting weight. Zepbound also has an approved use for moderate to severe obstructive sleep apnea in adults with obesity. That condition repeatedly blocks the airway during sleep. The published Caremark rules describe another route using a sleep study and current body mass index. In that document, the sleep study must show at least 15 breathing events per hour. Current body mass index must be at least 30. Your plan uses the written rules for your specific coverage. Your plan matters more than the headline. Sign in to your Caremark account and use the drug cost and coverage tool. Check whether Zepbound is covered, preferred, requires plan approval, and what estimated cost appears. Then call the member services number on your insurance card. Ask whether obesity medicines are included in your benefits. Ask whether Zepbound becomes preferred on your personal formulary October 1st and whether current or returning patients need new approval. Request the written approval rules instead of relying only on a telephone summary. Confirm the required starting weight, body mass index, health conditions, and weight management history. Confirm how much weight loss the plan requires and the rules for continued coverage before your clinician submits the application. Manufacturer savings can lower the final price. Separate from Caremark coverage. Eli Lilly says, eligible patients with commercial insurance covering Zepbound single-dose pens may pay as little as $25 for prescriptions. That price applies only when the prescription meets program rules. Patients with Medicare, Medicaid, or other government-funded insurance cannot use that savings card. The savings program may limit which Zepbound pen qualifies or cap annual savings. Those rules determine whether the savings apply. Your deductible and pharmacy network can change the bill again. A deductible is what you pay before the plan starts sharing more of the cost. A pharmacy inside your plan's network may cost less than one outside it, where coverage can be reduced or unavailable. If Wegovy is working well, Zepbound's return does not force a switch. The new placement creates another option. Before changing treatment, compare expected benefits, side effects, supply, plan requirements, and the monthly cost you would actually pay. If you previously lost Zepbound coverage, prepare before October. Gather your starting weight, body mass index, health conditions, previous approval letters, dose history, and treatment response. Missing early records can delay approval even after the formulary changes. If you already have Zepbound coverage, compare 3 dates: when your current approval ends, October 1st, and when your insurance benefits renew. Each can trigger another review, so checking early can prevent an avoidable interruption. If coverage is denied, match the response to the reason. Submit missing records. Appeal if the plan says the drug is not medically necessary. Ask whether the plan allows an exception if Zepbound alone is excluded. When every obesity medicine is excluded, your insurance does not include this type of treatment. The practical sequence is simple. Confirm coverage for obesity medicines, find Zepbound on your formulary, and read the written approval rules. Then check pharmacies your plan covers and calculate the real monthly cost. Do that before switching, restarting, or assuming the October change solves everything. Caremark will restore Zepbound as an additional preferred option on widely used commercial formularies starting October 1st, 2026. That expands choice, while your employer's benefits, approval rules, pharmacy network, and monthly cost determine whether you can actually use that choice. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.